I'm Jeff Allen, the Director of Sports Medicine and the Head Athletic Trainer at the University of Alabama. Any coach knows that sports injuries can happen in the blink of an eye. As an athletic trainer, I often deal with fractures, sprains, muscle tears, but one injury that is not often talked about but can definitely have a negative effect on an athlete's career is a labral tear. With me today to talk about labral injuries is Dr. Lyle Kane from the Andrews Sports Medicine and Orthopaedic Center in Birmingham, Alabama. Andrews Sports Medicine is the official sports medicine provider for the University of Alabama. Dr. Kane is a sports medicine trained physician with the Andrews Sports Medicine and Orthopaedic Center, and he's also an alumnus of the University of Alabama. And they're a great partner to our university and do a tremendous amount for our athletic department. Thanks for being here, Dr. Kane.
Thank you, Jeff. I appreciate it. My name is Lyle Kane. I'm an orthopedic surgeon at Andrews Sports Medicine, Orthopaedic Center in Birmingham. I specialize in sports medicine. Over my career, I've had the opportunity to work with a lot of different athletes at different levels, including recreational, college, and professional athletes, and had the opportunity to work with the University of Alabama over the past several years. Athletes sustain many different types of injuries. At Andrews Sports Medicine, we care for each injury with a specific treatment and a specific rehab program after surgery to try to return athletes to the same level of participation and get them back to where they want to on the field. One injury we see fairly often in sports such as football, hockey, soccer, and golf, and baseball is a labral tear. A labrum is the rim of little cartilage around the shoulder socket, and it's the attachment site for all of the major ligaments that help keep the shoulder in place and hold it together. Labral tears can happen in many different ways. One common way in football is by making a tackle or by landing awkwardly on the shoulder. The shoulder actually slips out of socket, and when this happens, it tears the labrum, which is the rim around the socket. If untreated, labral tears can cause persistent instability or dislocation of the shoulder and can cause symptoms that keep the athlete from being able to play. A second common cause of labral tears is the overhead athlete, like a baseball player. Baseball pitchers have repetitive stress on the shoulder that occurs from throwing a baseball many times over the years, and they can actually pull the labrum right off the top of the socket, which again causes pain and symptoms and instability. Symptoms of labral tear can be anything from mechanical symptoms like catching and locking. Sometimes an athlete gets swelling of the shoulder, and sometimes they even feel the labrum pop or tear when they injure it. So the symptoms are pretty widespread. The people at risk are two different scenarios. One is the contact sports like football, which are fairly common. The other is the overhead athlete like baseball, softball, even tennis players and javelin throwers and track can get labral tears. Treatment of labral tears depends on the sport and the time of the year. There are some labral tears that players can actually perform with by doing rehab with Jeff Allen and the training staff, by appropriate bracing and therapy. Sometimes we can get a labral tear patient through a season or through a time period without having to do surgery. But most of these require surgery to be repaired. The treatment for labral tear is actually surgical reattachment of that labrum back to the shoulder socket. This is performed by using a small camera called arthroscope. We take little tiny anchors that we put in the bone and we reattach that tissue back to the shoulder socket, which then makes the shoulder stable and gets rid of the symptoms. The success rate is very good, and about 95% of athletes can get back to the same level of play and same level of function as they had pre-injury. Andrews Sports Medicine is proud to be part of the medical team at the University of Alabama. We look forward to taking care of the patients if needed, and ultimately we're proud to be part of Jeff Allen and his staff who do a great job of getting these players back on the field.
You know, Dr. Kane, one thing that I stress to our athletes all the time, and I think you'd probably agree, that proper form and technique and understanding how to play their particular position is really important in preventing all injuries and certainly shoulder injuries. Would you agree with that?
No doubt, and that's one thing at the University of Alabama. We have the ability right now to do a lot of the preventative treatment strategies that you've talked about. Not only our coaches, but our athletic training staff, even our strength and conditioning coaches work a lot with the athletes on prevention of these injuries. And I think you can do that through proper training, muscle balance, and proper technique.
The University of Alabama has a proud tradition of excellence in athletics and in sports, and we're so proud to be associated with a group who has that same type of tradition in treating sports injuries.